Good afternoon and welcome to the Plymouth COVID update. This is number 77. We're coming to you live from PAC TV studios in Plymouth. It is Wednesday, December 9th, and it is 12 noon. We'd like to welcome all of you. This is our weekly update. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each week at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. And for questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today we have a number of participants joining Ken Tavares, Matt Muratore, and me, and they include Karen Keane, also Brian Palladino, Sue Giovanetti, Michael Jackman, Michelle Bratti, and Amy Naples. And we're going to get right to our panel and begin with the chair of the Plymouth Select Board, Ken Tavares. Welcome, Ken.
Thank you, Steve. It's a pleasure to be back this week. I'm going to deliver a very familiar message in just a few minutes. It certainly has been a trying time since last March, and government has been engaged in new activities that we haven't seen for 100 years. And we've been changing traffic patterns, cutting fees, extending restaurant hours, becoming proficient, I think, in Zoom, filing for grants, and 100 other new challenges. But the one thing that we can't do, and we can't do alone, is to wear a mask. And there's going to be, I know of at least one very important story today that you're going to be anxious to hear. It is so easy to comply with this, yet for some reason or other, we still continue to fight it. As a week ago, I think I mentioned that I was somewhat dismayed and shocked by the figures that Karen was posting at the end of the day, and that hasn't gotten any better. So we can't take anything for granted. It is our responsibility as citizens, as families, to wear those masks, to do what we can. We need to minimize the ability to catch this disease. So I'm going to ask you once again, please take a pledge this week. Sit around your family table, talk about it, and say, we are going to wear a mask. We're going to do it. It's not convenient, but we are going to do it. You need to emphasize that. Our children have learned their lesson. It is amazing the stories that people are telling of the children and how they're adapting. So why we as adults can't do it just boggles my mind. It's time to stand up and say we're going to do the right thing. And that is the one way we're going to beat this virus. I know we're all anxious to get the vaccine, but the vaccine needs help, and we need to be here for the vaccine. So let's all band together and do this. Wear a mask, wash those hands, and keep the proper distance. Thank you, Mr. Moderator.
For all of our viewers, we'd like you to know that today Zoom is having some changes in the presentation, and although at times the video may be stilted, the audio is coming through clearly, so we're just working with that. We do this presentation each week because we want to provide you with elected leaders such as Kenneth Tavares, Chair of the Select Board, with trusted information and with information on which you can rely, both for the town of Plymouth as well as regionally and nationally. And with that, we're going to go to our first panelist today. We welcome back Karen Keane. She is the Director of Public Health for the town of Plymouth. Welcome, Karen.
Thanks, Steve.
What do you have for us
everyone.
today, Karen?
Two important things to talk about today, Steve. The first is going to be, can you see my screen?
Yeah. Yes.
We can see you, yeah.
Does it say phase 3, step 1?
Yes.
Okay, perfect. The first thing we're going to talk about are the changes that are going to take place on December 13th Now, it's interesting here in the town of Plymouth because we did not move to step 2. Our Board of Health decided and voted to remain in step 1, phase 3. So we never made the change to 2 to go back to 1. We've been in 1. But there are still some changes that I think are important to point out to folks. The first 4 I have not changed for us. So we've always kept those numbers the same.
She
Outdoor
wants to show
gatherings
something
at
on the screen.
50, 25 people. This is new. Hosts of outdoor gatherings of more than 25 people will not be required to provide advance notice of this gathering to their local Board of Health. So that's a new piece that will come into effect on December 13th. This is the list of places that will have to reduce from 50 to 40%. Again, we did not make the change. Ours had stayed at 40%. Here are some changes, though, that will now take place for everyone. In the past, when you went into a restaurant, you wore your mask, but then once you were seated at your table, you were allowed to remove your mask.
Yeah. Karen, you
This
need to
is
share your screen.
changed. No,
Yeah, you're not screen sharing.
oh, I thought it was.
No.
Yeah. So just
Sorry.
if you want us to see it,
Screen share.
if you can screen share.
Okay.
So we're hearing from Karen Keane. She is the Director of Public Health for the town of Plymouth, and
How's that?
we just
Nope.
about, yeah, there we go. Terrific. So she's sharing her
Okay.
screen. Go ahead,
Excellent.
Karen. Thank you so much.
Okay, so, great, thank you. So we talked about the patrons not have to wear masks at all times. When they go into a restaurant and when they're seated, they must keep their mask on. They can only remove their mask when they're actually eating or drinking. Now that's a change. Before you were allowed to remove your mask as soon as you sat down with your party at the table, and you could keep your mask off during the entire time that you were there. Now there's a change. We go into the restaurant with our mask on. We keep our masks on until our food is delivered to us, where we can remove our masks for eating and drinking, but then the masks have to be put back on at all other times. Again, we are 6 people at a table. That did not change because we stayed in phase 1, step 1. Restaurants now will impose a 90-minute time limit on tables, and the goal of that is to make sure that people don't linger, that people come in, they enjoy their dinner, but then they move along. Musical performances will no longer be permitted at restaurants, and food court seating in malls will be closed. Now, food court restaurants can still serve food to go, but the seating portions will be closed. Another change for everyone, also for the town of Plymouth, has to do with gyms. Before, if you were at a gym and you were more than 14 feet away from the person closest to you, you could take off your mask while you were exercising. That is no longer a possibility. When you are in a gym, all patrons must wear their masks at all times. Also, in offices, employees must wear their masks at their place of work when not in their own workspace and alone. So if I'm in my office and I'm by myself, I can remove my mask. But as soon as I leave my office, I have to wear my mask when I go throughout the building where I work. Employers are also being encouraged to close or limit the use of break rooms. So those are some of the changes that are happening for the town of Plymouth effective December 13th. Again, I just want to remind people that a lot of these changes were the same for us because we did not move to step 2. The Board of Health voted to remain in step 1. So these changes are not applicable, or I shouldn't say we're not going back. We never left. Though there are some that I highlighted that are indeed changes as well for the town of Plymouth. That's the first thing I want to talk about today, Steve. And I will stop sharing this because I'm going to start sharing another one. And now we're going to talk briefly about the the new guidance for people who are in quarantine. Let's see. Oh, you can see that? Okay, perfect. In the past, if someone was in quarantine, and by quarantine we mean you have been exposed to someone who has tested positive for COVID. So you are a close contact. You are closer than 6 feet for more than 15 minutes to someone who has been infected with the coronavirus. So you have to quarantine. What that means is you need to stay in your home for what used to be 14 days. Well, that's changed. Now we have 3 different options for quarantining. There's the 7 days of strict quarantining, the 10 days of strict quarantining, and the 14 days of strict quarantining. Now, on the 7 days of strict quarantine, what it means is on day 5, if you are asymptomatic, you have no symptoms for the virus, you can take a test. Now, it can be either a PCR test or an antigen test. If that test is negative and you do not have any symptoms, then you can release from quarantine on day 8. So you can go back to work. We're not quite sure, we don't have the definitive answer on school yet. We should be getting that today. But this was a change because the data showed that people were not infectious post the 7 days when they weren't showing symptoms. This also allows people to get back to work sooner than 14 days. And especially folks who may not have accrued sick time or who don't have sick time at all, this helps them get back to work faster. The 10 days of strict quarantine, your release happens on day 11. If you have not experienced any symptoms up to that point, and you will conduct active monitoring through day 14. So this does not mean this is a non-test option. So you do not want to take a test, but you don't have any symptoms. So you can be released from quarantine on day 11, but you must actively monitor your symptoms and take your temperature once a day. Even if mild symptoms develop or the individual has a temperature of 100 degrees, they must immediately self-isolate and then contact the public health authority, which would be our office, the Department of Public Health here at the town hall, that they back into quarantine and get tested. Then the final option is the one that I think most people are familiar with, and that's the 14 days of strict quarantine. You again will be released on day 15 if the individual has experienced any symptoms during the quarantine period, even if they have had a negative COVID test. So let's say on the 5th or 6th day of your quarantine, you took a COVID test and it did come out negative, but you still have symptoms. You do not get to use that first option, even though you have a negative test, because you are not asymptomatic. You are having symptoms of the coronavirus, therefore you must remain in quarantine. No additional active monitoring will be required, and you can return to work on day 15. So those are the 3 options now for quarantining if you have been exposed to someone who is infected with the coronavirus. Now, of course, these are instructions. These have always been the instructions. These have not changed. They're posted on our website. They're posted on mass.gov. It talks about don't have any visitors in your home, stay at home, wear a mask, maintain social distance from people who also live in your home. If possible, use a separate bedroom and bathroom. Do not share eating or drinking utensils. Cover your mouth and nose when coughing or sneezing, and wash your hands frequently. So those have not changed. Those have always been the protocol for someone who is in quarantine. What is different now is when you can be released from that quarantine. So those are 2 things that I just want to talk about today, Steve, because they are changes to our residents that I think were important for them to know. Thank you.
Thank you. And Karen Keane is the Director of Public Health for the town of Plymouth, and we welcome her back. You can send her your questions to PlymouthInfo@pactv.org. A lot is happening in terms of changes for for the protocols that we are following here in Plymouth. At this time, we're going to go to our school segment. We welcome back Brian Palladino. He is principal at Plymouth Community Intermediate School. Welcome, Brian. And unmute yourself, Brian. You're on mute. And now
I should know
hear
that
you.
by now. I've been in enough of these. I should know that.
Okay, great.
Well, thanks for having me, Steve. So at the school level, obviously these next few weeks, this week is the second week from Thanksgiving. So we're closely monitoring our students and in communication with families whose students are not in school this week, just to make sure we stay ahead of the game around making sure families are supported and also that they're keeping their students home if they don't feel ill. So that's one of the things we're doing this week because, again, I think from the governor down, it's been a concern the 2 weeks after Thanksgiving. And we'll do the same following the holiday break in the next few weeks. We'll do the same there. But I have to say that the protocols that have been put in place seem to be working. Our students and our staff are doing a really good job at making sure that they're following those protocols, the cleaning up desks, the masks. I mean, that was a concern coming in that students may be uncomfortable wearing masks. And I can say from all the principals that have been dealing with it, that the students have been great. The staff has been great. Students that forget masks are asking right before they even come into the building for a mask that we have for them. Distancing, in the classrooms, in the lunches. I mean, basically, we've kind of taken the traditional school setup and revamped it to be distance, and from the lunchroom to the classroom. And the kids, they're resilient. They're flexible. They've kind of done a nice job with that, and even. I think the biggest struggle for our students are those times that they're not in the school, that they're learning from home, and they've had to kind of learn new skills, and our families had to learn new skills to help them. So, I think it's going in a good direction, but it's also, I think we as educators and families and teachers, and we want kids back full time, but we also want to do that safely. So when we do come back, everyone's safe, from our students to our staff to our families. I just looked up at the dashboard. So we have 7 active cases being from exposure outside of the school currently right now. We'll closely monitor those with our nursing staff. And I have to say, really plug our health services, our nurses and our nurse leaders, and doing a tremendous job. Making sure that families are supported, but we're also communicated with at the school level. Again, this is all to keep our students safe. And I know, at the high school level, you've seen that there are sports after school. There's things, and I know at the middle school level, that's a big part of our school, and keeping kids engaged in the school, and sometimes through different type of clubs and activities outside of school. And we're trying to slowly incorporate some of that into our school, because kids look for those type of clubs to engage in, and we've had some successful virtual after school clubs. We've had our Dungeons and Dragons club where kids can play online with teachers. We also have a cooking club that started up last week, where over 30 students were virtually cooking with a teacher and making dinner for their families, and it was a huge success. So we're going to look to continue to do more, both in school and virtually, to give kids those opportunities, because that's, in my opinion, that's kind of what middle school is about, trying out different things to get interested in and maybe pursue outside of the school. So we're trying to provide a little sense of normalcy here at the school level as much as we can in the environment we're in. So, but I think, as a community, and I think, Ken, you had said it earlier on in your part, is, it's proven in the school right now, where I know at least at PCIS, there have been no exposures coming from the school, and it's in large part, in my opinion, are the masks. If that's something we can do, I think it has proven itself in our school and in the schools outside PCIS as well. And the kids are doing it, and they're not fighting it. It's part of their day. So that's our school right now. So hopefully, we can learn from this, and when we get out of this COVID time, we're going to be stronger students, teachers, and families. So.
Thank you, and that's Brian Palladino. He is principal, Plymouth Community Intermediate School. He'll be here to answer your questions. Send them to PlymouthInfo@pactv.org. And now our next guest, we welcome back Sue Giovanetti. She is the Executive Director for the Plymouth Area Coalition for the Homeless, and she's going to update us as to what they're doing. But she also wears another hat, and that is as president of the Plymouth Rotary Club. And last week, we had the captain from the Salvation Army talking about what they're doing during this season. And Sue, I know that your Rotary Club is also helping the Salvation Army. Can you tell us a little bit about that as well?
Well, I guess thank you for inviting me to join you this week. Rotary definitely was out there. We were out there last Saturday in the pouring rain, ringing the bell for the Salvation Army donations, and certainly glad to do it on behalf of Rotary. And we did get wet. There was no question about that. But it was all for a good cause, and certainly the Salvation Army has provided services for our community for forever, right? So, and that's what we're all about. That's why the show exists. It's about the community really coming together and trying to figure out a way to beat all of this. And beat it, if not beat it, then certainly to provide everyone with the resources to face the challenge. So at the coalition, as you can imagine, we have many services. Shelter-wise, you know, we're always full. We have 12 families here, and COVID precautions are always in place. They have been since March 7th. We basically created a bubble around the shelter, with the exception of we do, just like other families, have to send the kids out to classes or families to doctor's appointments and so forth. So as much as we have 12 families and in some cases up to 3 individuals living in the same congregate living space, we are trying to adhere to as many precautions as we possibly can. But that's a challenge, there's no question, but we addressed it early on, and we continue to get support from the state and from various other folks that we collaborate with. So that's certainly, you know, the needs of the homeless haven't ebbed at all. You know, the eviction moratorium slowed the number of people entering the homeless population, yet families entering the homeless population. Yet we know that there are 10,000, I believe, across the state. We've been able to, you know, I hesitate to say out loud, we've been able to stay free of any positive cases here at Pilgrim's Hope. Not to say that we haven't had a couple of concerns here and there on both staffing and residents or clients, but we've been able to come through that without any heightened concern, again, with the support of DHCD. So masks are a challenge for us, but on our other programs, at the food pantry, that's where we see the across the community need has skyrocketed. We're serving 4 times the number of food insecure families, or families and individuals, since March. It did ebb a little bit in the summer. It's back up there. We gave out at Thanksgiving, we gave out over 300 Thanksgiving dinners. That translates into just under 1,500 people, more than likely. It's somewhere between 1,200 and 1,500 people. So there's a lot of need. I was speaking earlier today in a meeting with Mike, and one of our concerns are those individuals and families who are impacted by COVID that are not generally in the system. They're unfamiliar with how to maneuver through the system and know where to go to get SNAP benefits or other types of assistance. So we're making a very strong effort to reach out across the communities that we serve to be sure that that messaging is there, and for them to know that we, in fact, as well as other agencies, can serve them. And that's incredibly important. Not only are these families all new and individuals all new to needing support services, but an additional barrier is the strength of, I guess, because we're all so humble, we've not been faced with this. How do you build up the ability to say, I need help? And that's what we're really trying to reach, those individuals and families who need that extra encouragement that it is okay, and we're here to help them, and we can also put them in touch with other agencies that can fill in the gaps. So those are important messages, I think. The Children's Holiday Fund is a, we're in the throes of that right now. The need is certainly great. We want every family and every child to be able to experience the joys of the holiday season, as well as knowing that there'll be a holiday meal on their table. So, that's all part of what we do. I guess a message that I'd like to share today is that while our application material and request for assistance do state an earlier date for submission, we're accepting applications as long as we can. We're making every effort to be able to fulfill every need that is out there that comes our way. So we do, as far as children are concerned, we're one of the agencies that will provide gifts up to age 18. And that's an important message because, again, Brian spoke about the tweens in there. Those kids are, we have our share fail living here. They need to feel the love and know that they're important and valued. And a lot of times we think that they can get by without that extra demonstration of love or caring. And we have always and will continue to provide for them during the holiday season. So those are a lot of things that we're seeing. Certainly nothing is more gut-wrenching than the number of people that just aren't used to this, and they may pull up in a nice car. Doesn't mean a bit. We all know that people are just one paycheck away frequently from losing everything, and so it's nearly a daily occurrence that we have people that are just incredibly humble that they can't meet what their family needs. So, definitely a no judgment zone with the coalition. We just want to help. We have an incredible staff. We're without most of our volunteers. We've gone from a core of 75 volunteers down to probably about under 10, which is pretty remarkable. But again, that's a piece of us trying to keep ourselves within a bubble and protect the families that are living here, as well as our staff and volunteers. So I hope that helps out. And I think, if anything, I just want to let people know that, we've been here since 1985. We'll continue to provide basic needs assistance in any way we can, even to the point we had a family yesterday that had a house fire, and all the documentation was burned. And so that's like recreating your life 2 weeks before Christmas. You have to kind of take a deep breath and figure, okay, where do I go now? What do I do? I will say they had a mask on when they were speaking with us. So the message certainly got to that family, and they've had incredible adversity. So, I don't know, thank you for the opportunity to share what we do. And I just hope that folks know they can always pick up the phone and call us. We have a 24/7 hotline that will provide all types of resource information. So it's always manned. There's always someone to speak with. We are open 365 days a year because the need is that great, and we always will be, and there always will be a person that can answer the phone and guide and direct someone in need. So,
thank you, Sue Giovanetti. She is the Executive Director, Plymouth Area Coalition for the Homeless, and we have many people and groups coming to us this holiday season to share what they are doing in the Plymouth community to respond to the coronavirus. At this time, we're going to move on to Michael Jackman. He is the District Director for Congressman William Keating. Welcome, Mike.
Thank you, Steve, and thank you as always to PAC TV for hosting this forum and giving us a chance to hear from so many wonderful groups and agencies and individuals in the town and share what's going on in our office. I do want to thank Sue. She came to our meeting this morning for South Shore Community Partners of Prevention to talk about her work and the Children's Holiday Fund, and it's great to know our theme today was gratitude, and we're very grateful for the work that she does and her staff and her volunteers, and to keep people safe and housed and fed as much as possible during these difficult times. There's no doubt that the need is great. We're seeing it all throughout our district, the South Coast, the Cape, the islands, certainly in the Plymouth area as well. And it is a need that goes far beyond what normal times we would be seeing. So it's important to recognize that. And, I feel like a little bit of a broken record because every time I come on here, we talk about the next relief package. I think I've been talking about that since May, every few weeks that I've been on. But all indications are that we are approaching some sort of resolution to have a new relief package passed by Congress. The White House now has weighed in, so there's every indication that it'll be approved by the White House as well, once the Senate and the House can come together to agree on the provisions of this package. Every indication is that there will be extended unemployment benefits, and I know Rep. Muratore can tell you, as well as Senator Moran, and our staff can certainly tell you that people are still filing for unemployment, new claims every week. Folks needing that extra assistance from the state at this time, but hopefully if the package passes, there'll be additional benefits from the federal government too. Maybe not as generous as the original CARES bill provided for, but enough to give the families a little bit of a boost so that they can provide for their families and can meet their daily needs of living. Also some aid for small businesses is expected to be included, including another round of payroll protection. Every indication, again, is that it will be geared towards smaller companies, below 50 employees. Waiting to see the final details on that, but that is the indication that we have. Hopefully the next time I come on, we'll have an update that'll be more than just getting closer, more than just the same report I've been giving for the last few months. But we are hopeful about that and working on that. They are working on that every day. Congressman is in D.C. as we speak. A few other things I just want to mention. I think everyone is seeing in the news, the Biden administration has rolled out its health team. Very pleased to see that it includes some folks who are working locally, meaning in Massachusetts, on the virus fight, combating the virus. Also pleased to see that there's a specific task force addressing inequities in health outcomes, especially around COVID-19, how different populations have been affected and adversely affected by the pandemic. So we're looking forward to working with them as the new year approaches. And excuse me, sorry about that. I did want to amplify something that Ken mentioned about wearing masks. The president-elect has announced that the first 100 days will be 100 days of mask wearing. And as we approach that day, January 20th, when the new president will be sworn in, 100 days from that would get us into March or April. And we're hopeful that there'll be more vaccine available to people in that time frame. But it's also important to note that we're not entirely sure what the vaccine will mean for contagion and the ability of people to actually spread the infection. The way that the vaccine was tested was to limit the impact of making people sick and making people severely ill, but there's still a lot of question as to what it means for your ability to spread the infection from person to person. So I won't go into the details because I certainly will probably get it wrong. But there's a lot of science behind it. I think there's more studies need to be done to give public health officials, decision makers, medical professionals, give them a better sense of what the vaccines will mean for infection rates. And until we know that, we really do need to keep up social distancing, physical distancing, and limiting gatherings and wearing masks. Because, I said it last time, but I think it's important to point out again, we see the light at the end of the tunnel, but we are still in the tunnel. So until we reach that light and we reach the community immunity levels that will allow us to squash the virus, that we need to do all we can to fight it, and that includes wearing a mask. So, Ken, thank you for emphasizing that. I'm glad to kind of put an exclamation point on the end of that, and eager to take any questions that anyone has. Thank you, Steve.
Thank you, Michael Jackman. He is District Director for Congressman William Keating. You can send your questions to PlymouthInfo@pactv.org. We welcome back Michelle Bratti. She is the Director of Elder Affairs. Michelle, earlier this week, an associate and I visited an assisted living community here in Plymouth, and I was quite impressed with the screening that they had when you first came in. It was a machine not only prompting for lots of health-related questions related to the coronavirus, but actually the machine, when I put my head forward, took my temperature. So I was quite encouraged because the visitor before me and after me, likewise, were being screened in that manner. Made me feel that the residents in the community were being protected. What do you have for us today? And
Well,
you need
that
to unmute.
is really good news. I did.
Go ahead.
Can you hear me?
We can hear you. Yes, go ahead.
Okay. Okay, great. Thanks. That is really good news to hear. I like to see and hear that the rest of the community is, especially with the elder population, Steve, as you know, are taking those precautions. While there's various machines out there, we too have a machine that they just kind of put their forehead up to, our seniors. And we are pretty stringent on our screening process as well. It's all about safety, so good to hear. Thank you, as always, for inviting me to be a guest, and hello to all of my esteemed fellow panelists. Thanks always to PAC TV for having us today. Well, Cal had a few significant phone issues over the past week or so, and I'm just pointing that out. I'm happy to report that they were fixed. I'm pointing it out because I want to make sure that if any senior called us within the last week or two and left a message and we have not returned your call, it is simply because we did not receive it due to the phone issues. So I want to make sure there's no senior out there forgotten or thinking that their message is lingering somewhere. Please call us again if you need anything. And if you couldn't get through during that time, please contact us so we may assist you in any way. I will go right along with the theme. Due to increased COVID positive cases, current state mandates, and the remaining holidays in which families will gather, Cal will be temporarily suspending indoor programming until further notice. Our goal is to return to our limited indoor programming by January 11th, but we will evaluate current data the week prior and make decisions from that data. All decisions are based on real-time information, and most importantly, always with your safety in mind. Several of our indoor programs will be held virtually via Zoom during this time period, so please look for Cal's constant contact information to register or visit our Facebook page or Cal Town website page for details. We will continue during this time to provide essential services without interruption, including Meals on Wheels, grab-and-go lunches, and our vast array of virtual programming. To highlight a few of our awesome virtual programs, we're pleased to announce that on Thursday, December 10th at 9:30 a.m., Cal and BID have teamed up to bring you Healthy Eating Made Easy with Marcia Richards, a dietitian from BID Plymouth. This virtual program will explore holiday treats that actually boost your immune system and tips on winter safety. We are also pleased to spotlight our new virtual COVID support group, which is designed to help acknowledge difficulties during this time, ways to increase resiliency in uncertainty, and most importantly, find joy in the small accomplishments of each day. This will run for 4 weeks and begins on December 11th from 2 to 3 p.m. Call Cal directly or visit My Active Center to register for either of these events. We still, however, do wish to spread cheer and celebrate the holidays with you, our seniors, in a safe manner. So please consider joining us for our outdoor drive-through holiday parade extravaganza. This event will be held on Friday, December 18th at 1 p.m. with an inclement weather date of December 22nd. There will be so many awesome events on this day, including special gift bags, golden ticket surprise specials, in which winners will receive a New Year's Eve prize pack on December 31st, tons of holiday raffles, holiday car photos with Santa, sweet treats, and supportive community materials. Our staff and invited dignitaries will be dressed in holiday cheer, and seniors will vote verbally as they exit the parking lot for the staff member with the best holiday attire. We welcome you to bring your version of holiday cheer and celebrate the season at Cal. Registration is limited, so please go to My Active Center to register online or call Cynthia Snow at 508-830-4230 to reserve your spot today. Thanks, Steve.
Thanks. And that's Michelle Bratty. She is Director of Elder Affairs. She'll be available to answer your questions. Send them to PlymouthInfo@pactv.org. And our next guest, Amy Naples, she's usually known as the Executive Director for the Plymouth Area Chamber of Commerce, but now she is also honored to be the recipient of the 3rd Annual Phyllis Hughes Award. So congratulations, Amy. And Amy, yesterday the governor spoke to all of us about changes in some of the protocol. And at the same time, I received from one of your businesses, a local restaurant, an online menu for holiday catering. And this morning, when I was at a local fitness center, they were already announcing some of the changes that they'll be implementing on Sunday in order to cooperate with the changes. So you at the Chamber of Commerce and your businesses sound like you're on board with meeting the changes that have occurred. Amy.
Well, first, thank you, Steve, for that. I'm truly honored to be receiving, or to have received, the Phyllis Hughes Award. I follow some pretty big people in our community, and I am so honored because, and humbled because there are so many great people in our community, and you know, I was overwhelmed by the confidence and support to be chosen. But as you said, we did have some changes. It isn't anything too major from where we were at, as Karen reported earlier, which was so great because she saved me about 5 or 10 minutes today. So, and I have to say, our business community is doing the best they can. They are truly ahead of everything. They are ensuring the safety of their patrons, their customers, and you know, they're working so hard, and they are kind of ahead of the game. Once they find out about these things, they have implemented, and they are used to this, and they're providing such great, safe environments for customers. So I think that's really important to note. We are very excited, and I don't know if you can see my shirt, but it says support local, and I'm always yelling from the rooftops to support local, so I thought I would wear it, kind of compete with my buddy Matt Muratore and his great hats and t-shirts. So you can purchase this at Locally Yours, which is a small business in Village Landing. But in an effort to stimulate our local economy and support our local businesses and keep the cheer here, we are so excited for our hometown stroll, which kicks off tomorrow, December 10th, and runs through December 13th. However, many activities are going to be happening all season long. So also to note, these are all COVID-friendly activities as well. Even with the governor's orders, they fall within that, and we are taking every precaution possible. So we've been very busy planning and kind of putting this together. You can journey around downtown and waterfront for the Festival of Trees, which are all outdoors. So there's Christmas trees lined up down Main Court and Water Street, and these are sponsored and decorated by local businesses. They are so beautifully done. They also serve as a wayfinding, so they are outside of local businesses in an effort to catch your eye, and hopefully people will patronize that local business they're outside of. We have 21 in total, and these will be up for the entire month. We do have a map on PlymouthChamber.com of all of the locations around town. I do want to give a huge shout out to DPW Director Jonathan Beater and Forestry Division Nick Fiala for assisting the Chamber with this huge project. It was a big undertaking, and it would not have been completed without them. So huge thank you. The town of Plymouth is always there to support us, and we're so appreciative of that. In addition, we're having very festive window displays. Businesses are decking the halls, well, actually just their storefronts, with some great festive decorations to keep with the theme of keeping the cheer here. In addition to the window displays, we thought it would be fun to have a friendly competition, and that will take place virtually, which we will have photos of each participating business on our Facebook page, and we will award a business the coveted Nutcracker Trophy and a great marketing package as a prize. We also have a snowflake scavenger hunt. Large white snowflakes will be hidden around town. And families can head out in search of those snowflakes. So for every snowflake they find, that's an entry, and they can email a list to Bob at PlymouthChamber.com of where they saw all of the snowflakes around town for their chance to win $200 local gift cards. And then we'll have some runner-up prizes as well. So it's an easy, fun, something to do with your family this weekend. You will also get into the holiday spirit with Santa's arrival to Plymouth by boat because of COVID. So thank you to Plymouth Harbor Master Chad Hunter for providing the sleigh this year. Santa will be cruising the harbor at 2 p.m. and families can view Santa anywhere from the waterfront, particularly Town Pier, State Pier, and the Maritime Facility, the boat ramp. Restaurants and retailers will be offering deals, promo specials. A complete list is on the Chamber's Facebook page as well as our website. Something fun this year and hasn't been brought back for quite some time is a mailbox. Santa left a mailbox at Town Hall where children can send letters to Santa. It's wrapped beautifully in Brenner signs and on for us. So it's a great photo op for families as well as children send off their letters for Santa. The Antiquarian Society is holding a pop-up at the Hedge House lawn on Saturday, December 12th from 11 to 2. There will be sweet treats from local stores and also a pop-up public art display from Card My Yard in Shirley Square on Saturday and carolers at Sea Plymouth on Saturday as well. And then I'm also very excited to share we'll be launching our 11 local giveaway in an effort to support our local retailers and provide another incentive for customers to shop local. So for every $25 spent at a participating retailer, you'll receive 11 local ticket. So the more you spend, the more chances that you will win. All of the prizes are from our local small businesses, which are amazing, and they vary from dog grooming to beautiful bracelets. So the giveaway will run from December 10th to the 21st, and a winner will be announced via Facebook, the Chamber's Facebook page, on December 23rd. So for a complete list of everything I talked about, you can visit the Chamber's Facebook page as well as PlymouthChamber.com. And lastly, we did release our holiday gift guide. It is much beefier than usual, and we've selected our staff picks as well as great unique items. So I said, I think at our last, or the last time I was on PAC TV, I'm a great gift giver. So check that out. I've selected some great ideas that support our local businesses, and we encourage you to share that on your social platforms as well. And then I also did want to extend a thank you to Chairman Tavares and the entire select board who voted last night to maintain the single unified tax rate at the tax classification hearing. We know how important this is for our small business community. So on behalf of the small businesses, thank you. And that is our chamber update for today.
Area Chamber of Commerce. She'll be here to answer your questions. And at this time, we now return to Plymouth State Representative Matthew Muratore for his State of the State message. And Matt, seems like every week we're at number 77 on our updates. I think you probably have some update at the state level today and any news you want to share with us. Welcome.
Yeah, absolutely, Steve. Thanks so much. And, you know, it's amazing looking back. And I always try to look back in March and April and try to compare where we are now. And just listening to like Amy talk and what the chamber's been doing. And we've learned so much. We've learned so much in the last several months that people are so creative. There are things they can do and people really step up. And we thank Sue and for her organization and what she's doing to help really people in their need. And she's right. People who have never really had the need before. But they need it now, and her group is really stepping up. So, and it's also nice to see that that the federal government is now stepping up. Thanks, Mike Jackman, for and helping us. Hopefully, going to help us all out with another package. So, so that's really good to hear. So, let me start with just some of the comparison of the numbers first, Steve, and then the governor's office just sent out an update on the vaccines, and I want to give you that as well. So real quickly, the positivity rate is now 5.81%. Back in June, around the same time frame, it was 8.15%, and in April it was 24%. So you can see the comparison of where we're at. There are now 253,649 cases of COVID here in Massachusetts. Right now, 58,601 are now active cases. The average age is 38. Back in April, it was 54 years old. The total number of deaths, 10,833 right now, with almost 7,000 of those coming from long-term care facilities. We also have, with regard to hospitalizations, we have 1,552 folks in the hospital. Back on April 23rd, there were 3,890, almost 3,900. So you can see the differences there. We also have 310 people in the ICU, as well as 160 of those folks that are actually on ventilators. The capacity in hospitals is still there. We have roughly about over 2,000 non-ICU beds open and about 600 ICU beds that are open in the Commonwealth right now. In the Northeast part of the Commonwealth, there are no beds available. But the DCU Center is now open for surge capacity, and there's another one on the North Shore that's going to be opening up any day now as well. So again, we've learned a lot from what happened back in March, April, and May. So we're able to plan better, just like we're doing for the economy, as we're doing for the hospitals as well. The hospitals, though, as you heard yesterday, non-essential elective surgeries will be canceled as of this Friday. Again, in anticipation. Not because we don't have the beds, but in anticipation that we're going to need more beds and not to overwhelm the healthcare workers, whether they're in long-term care or hospitals or assisted livings. So that's the reason for those steps being taken, the preventive steps. In Plymouth County, there's 16,840 cases that we've had since the beginning of this, with 920 deaths. Now, with regard to the vaccine, Steve, the governor just came out with this. So we have 300,000 doses have been ordered from the federal government. They will be in by the end of December. The shipment will be in by December 15th. So that's right around the corner. They're going to be delivered to 21 hospitals across 8 counties, and then they will distribute them to all 74 hospitals and all 14 counties. And this is how it's going to work. There's 3 phases to this. Phase 1 will begin, as I said, December 15th, and will run through February 21st. The clinical and non-clinical healthcare workers doing direct and COVID-facing care, they will be the first priority. Then it will be long-term care facilities, rest homes, assisted living facilities, police, fire, and emergency medical services, conjugate care setting, home-based healthcare workers, and healthcare workers doing non-COVID facing care. By this point, we're going to have over 2 million doses to deal with all this. In phase 2, which will begin in February of 2021 till April of 2021, individuals with two plus comorbidities, which are high risk for COVID, then the early education, K-12, the transit, grocery workers, utility workers, food and agricultural workers, sanitation workers, public works, and public health workers will get the vaccine. Anybody, and pay attention to this, Steve, you fit into this category, age 65 plus will get vaccines in phase 2. So that's sometime in February, you can start standing in line for that. And then individuals that, again, have some healthcare issues. And then the final phase, phase 3, will begin in April 2021. And basically, that's going to be for the general public. That'll be for the rest of us. So as you can see, the hope is on the way. But as everyone's been saying, we are in a tough situation right now with the, with Thanksgiving just occurring. We've got Christmas coming up. The governor has rolled back, as you heard Karen and Amy talk about, has rolled back some things to help the cause. But the main thing is the wearing the mask. And I can tell you, Steve, you and I had this conversation yesterday. I was tested positive for COVID. Happened, don't know how it happened. We are very careful. We don't really go anywhere. If we do, we wear masks. We have some kids. We have a lot of kids, and they have friends and all that. So you just don't know, where you get it from. And when I got that call from Karen Keane, and I got to tell you, Karen is wonderful. I thought I knew this until I got it, and I'm thinking, wait a minute, I've got it. Now I got to get my kids tested. Thank God they're all negative. Kristen got tested. She just found out she's positive. Again, no symptoms. But at least I have a quarantine buddy now. I was alone for 7 days, so I have somebody now. She's not happy about it, but I am. I'll be out of quarantine Saturday. She's going to be in quarantine until next Friday. The kids are pretty much on their own and what they're going to do for meals, but they'll figure it out. But then you start thinking about, okay, so now how does it affect the kids? And now we're finding out that the kids, they're quarantined, obviously, and they have been since I found out last Thursday. But now they're not going to be able to go back to school till the 23rd. So I tell you this only to let you know how this affects so many things. It's such a domino effect that happens with this. And again, you don't know how you do it. Obviously you may let your guard down, whether you're at home or wherever. But wearing the mask, as everyone is saying, that's the real deal. And it's going to get worse. It's going to get worse over the next 30 to 45 days. When the new president comes in, people have to wear the mask. It's not going to be no different than what we're doing right now in Massachusetts. People have to be wearing the mask when they're outside. And knowing that the vaccine is coming, if we can just hang in there, get everyone to do what the kids are doing in school, as Brian has said, the kids have done fantastic work with this. And we need to follow their lead. And if we continue to wear masks, and follow the guidelines of washing the hands and social distancing, we will get through this. We'll get the vaccine, and hopefully, by the summer, we'll be seeing the 4th of July parade and Plymouth 400 doing all their events. But let's all just hang in there a little bit longer, and we will get there. And that's it for today, Steve.
And that's Plymouth State Representative Matthew Muratore. Matt, thank you for sharing your own personal experience, and we're so pleased to hear that both you and Kristen are asymptomatic, and we wish you good health as you continue to deal with the coronavirus. I did want to mention that our partner here at PAC TV is involved in this Saturday, December 12th from 6 to 9. There'll be a virtual event called Poppin' In for the Holidays. It's an evening with the Sons of Serendip to benefit the Philharmonic. So mark your calendars again this Saturday from 6 to 9 p.m. live on PAC TV. And at this time, we're going to go back to all the members of our panel to hear their closing thoughts. We're going to begin with Karen Keane. Karen, we just heard from Matt. There's a lot going on in the town of Plymouth. What do you have for us today as a takeaway?
Thanks, Steve. Through contact tracing, a few things have come up lately that I just want to address to the residents of Plymouth. One, thank you for everything that you're doing. So many of you have reached out to say that, what else can we do? We want to do the right thing, and you are. And there are some of you who, even though you've done all the right things, have still come down with the coronavirus. And I want you to know that that's okay. We're going to get through that too. And that even though you wore your mask and you socially distanced, perhaps it was a workplace exposure. Perhaps like Matt mentioned, your children, there's so many different things that can happen. But I want to just take this time to say to folks, thank you. Thank you, thank you, thank you. And we appreciate all of you who are trying to do the right thing, who are doing the big three, who are wearing the mask, who are social distancing, and who are washing your hands, because that keeps you safe and it keeps others safe. And I just want to wish everyone a happy and healthy holiday season. Thanks.
Thank you. That's Karen Keane. She's the Director of Public Health for the town of Plymouth. And at this point, we're going to go on with our panel and welcome back Brian Palladino, Principal, PCIS. Brian, what do you want us to remember today about Plymouth Public Schools?
I just think, there's a lot of things that we have to do to continue to keep our schools and our students in school and our schools safe. And one of those things, along with a mask and washing hands and socially distance, is also, and I think our families have done a really nice job of this, is if they have symptoms, if they have a scratchy throat or a runny nose, keep them home. And then also just make sure you're communicating that with a nurse so we can monitor that as well. So I think, if we can do all those things, and it's really been very helpful here at the school level to have those and, monitoring those symptoms and also just reporting them and keeping them home if you can. Also just, we're in the holiday season, and I think we all know that families are struggling right now, food shortages, and then just providing things for the holidays. I know the schools are all trying to do something to support those families. Reaching out to the schools to see if there's a community member that can donate food or donate any gifts for students. I know here at PCIS we're doing another food drive. We're providing meals for families over the holiday break, but we're also trying to provide often overlooked teenage, middle school kids around the holidays. I know that the donations that are given are typically for the younger children. So we're accepting gifts here, and what we're going to be doing is allowing some of our students to go into a room and do a little Christmas or holiday gift grab. So there's a lot going. Reach out to your schools, see what they're doing, see how you can help, because it's a team effort, and particularly around the holidays, they need it.
Thank you, Brian Palladino. He's principal for Plymouth Community Intermediate School. And we're now going to go back to Sue Giovanetti. She is the Executive Director of Plymouth Area Coalition for the Homeless. Sue, what should we think about today?
So I basically, Steve, certainly know that help is available, remains available through the Plymouth Area Coalition. Certainly with food, we run the Children's Holiday Fund, and we're still accepting applications regardless of what the printed applications say. We will be addressing every need that comes our way, so please don't hesitate. Our number is 781-582-2010. There will always be someone there to answer your call. And that is help with holiday assistance. If you need food at any time, we always have emergency food boxes available, but certainly continue to work with the community and try to provide food resources for anyone that no one will be turned away. I guess pretty much that's the message. We're here to support you in any way you can. Information is also at PlymouthAreaCoalition.org. And please don't hesitate. I personally will be glad to follow up on any requests that comes our way. So thank you.
Thank you, Sue Giovanetti from the Plymouth Area Coalition for the Homeless. Michael Jackman, District Director for Congressman William Keating. Mike, we listened to our panel today at the local level. We hear from Karen Keane and Ken Tavares from Plymouth. We hear from Matthew Muratore at the state level as well as the governor yesterday. And now, what do you have to remind us about the help that may be coming at the federal level?
Yeah, so all of these great programs that Plymouth is doing and the state is rolling out as well. And I know Matt and the rest of the delegation are fighting for funding for Plymouth on a daily basis. But a lot of that funding does come from the federal government. That's important to note. The package that the House passed back in May did include significant funding for state governments because every state government is facing a huge shortfall from tax revenues, certainly no different here in the Commonwealth of Massachusetts. The Congress is still fighting for that. The House is fighting for that. That's one of the issues that is still being discussed and under consideration between the House and the Senate. So it's so important that we get the funding in there to provide for vaccine distribution, continued testing during these stages of the pandemic, funding for hospitals, food, USDA, agricultural subsidies, and funding directly to families so that they can purchase food, LIHEAP, fuel assistance. There's so many programs that get funded on the federal level and that the state implements that it's great that we have the partnerships that we do. We're always, we have a great partnership with Rep. Muratore, Senator Moran, Rep. Lenatra, and the rest of the delegation in the Plymouth area. I want to extend best wishes to Matt for dealing with this health crisis, and especially extend sympathies to your wife for having to quarantine with you. I know that can't be easy for her, but we hope you the best as you deal with this, and we look forward to getting through this where we can all get back together and celebrate all that we have done and all we have accomplished in keeping our residents safe and keeping that safety net complete and allowing people to get through this as best they can. So thank you all, and look forward to hearing more from the rest of the panelists.
Thank you. Michael Jackman from Congressman William Keating's office. Michelle Bratty, you're the Director of Elder Affairs, and we know that this pandemic is greatly affecting our seniors, and we're grateful for all the work that you and your staff do for us. And even though your building may be closed for a while, you're still going to be available to support our seniors.
Oh, as always, Steve, you know it. We've been here before, and we absolutely know that our seniors know that we are available no matter what, whether there's something going on in a specific room or not. We are here. We are a phone call away. We even find very creative ways to get people what they need when they need it. And we've done virtual programming for a long time now, a long time being March, right? Crazy, but there we are. Definitely want to extend well wishes to Matt and Kristen for their continued recovery. And congratulations to Amy. There is no one more deserving of that award, and we are so lucky to call you ours. So that's awesome. Steve, you did touch on this, but I did want to share that the Plymouth Philharmonic will be hosting their virtual event, as you mentioned, popping in for the holidays with Sons of Serendip to benefit the Phil. The amazingly talented Sons of Serendip will perform their gorgeous full-length holiday concert from their home studios. Special guests will pop in throughout the evening, including Phil musicians who will perform in small virtual ensembles from their homes as well. I know our seniors love the Philharmonic, and the ability to listen to some beautiful music from the comfort of their home, I think will be a great Saturday night for them. It's delight in a night of pure holiday entertainment, music, and fellowship. Find your happy place in the comfort of your own home and enjoy the gift of music. Tell friends and family this is an event for all ages, even though I just mentioned our seniors. This event will be aired on PAC TV, Comcast Channel 13, and Verizon Channel 43. This event is sure to bring much needed smiles to all, as only music can. Thank you.
Thank you, Michelle Bratty, Director of Elder Affairs. We're now going back to Amy Naples, the Executive Director, Plymouth Area Chamber of Commerce. And Amy, we mentioned before, I've actually been stopped in public from time to time by people who have watched these updates and remark about how comforted they feel from knowing that there are people locally and groups and organizations such as the Chamber that are supporting our community. And I know that businesses are particularly grateful that the Chamber is there to provide some organization and structure to the business community in Plymouth. So what do you want us to remember today on this presentation?
So thank you, Steve. And yes, I think businesses do feel a level of comfort knowing that we are here working for them. We are here to offer advice. We are here for them for anything at all. I want to thank all of our panelists today. That everyone on here is making a difference in our community, and I'm so thankful for their hard work. I work with the businesses, Michelle works with the seniors, and we are all working so hard, and I think that we are so fortunate of the people we have in our community that care so much and the passion behind it all. So I just want to thank them for their hard work. This time of year is particularly hard with personal things going on, and they continue to give it their all and support who they need to support. I also want to thank our community for supporting local. Our local businesses have been communicating to me how thankful they are that they have seen a good increase and that they've been very busy and there's been lines outside of their doors. So keep up the great work in supporting our local businesses. But as always, we are here for every business in our community, and my door is always open. I'm a phone call away. People can reach out at any time, and I'm happy to meet or speak with them. And certainly sending well wishes to Kristen and Matt. I'm so sorry to hear that. Glad that you're both feeling okay, and we hope everyone else stays well. Thank you, Steve.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Returning now back to Plymouth State Representative Matthew Muratore. Matt, you've been here for many months, serving both as a leader in the community and also now as a role model for all of us. So thank you for sharing with us. And what do you want us to remember today?
Well, first of all, I want to echo Amy's comments too. Thank you, Amy, for what you're doing for the businesses. Congratulations once again for a well-deserved award. Michelle, what you're doing for the seniors is just amazing. We have about 18,000 seniors in this community, and you're keeping in touch with them with your robocalls. It's just amazing. And of course, Sue knows how I feel about her and her organization. It's just fantastic. And Karen Keane is my new best friend now. I'll probably be calling her again. And you need to know too that as wonderful as Karen is, the school nurses have been wonderful as well. As you know, we have kids in a couple different school systems, so we're constantly in contact with the nurses there, and the guidance they're giving is fantastic. I do know that the Department of Education is meeting today, this afternoon, I believe it is, and they're going to be discussing some of the changes. So hopefully my kids will be able to get back earlier than the 23rd of December. So we're waiting to see what the guidance is going to change on that, because they have been negative. But I got to tell you, when we told our kids that they couldn't go back to school till then, one of them started crying. Yeah, but it shows you though that the contact that they have, it means a lot to them, to being with their friends and all that. So it does get emotional too. So sorry about that. And I thank the Congressman for what he's doing. We really appreciate it. And you're absolutely right. We need the funding. We just passed the fiscal 21 budget, but it's a bare bone budget. It's going to help organizations like Sue and the local aid for the towns and the schools, but it's bare minimum. Actually, the schools aren't even getting as much as they were the last time. So we really appreciate what the Congressman is doing to get this funding here. We need it desperately, as you heard from the vaccines that we're going to be distributing. We're going to need funds for that. So thank you so much. And Steve, instead of ending with my usual controlling COVID is good for the economy, the health, and the schools, I want to read a little poem that one of our clients from one of our nursing homes, as you know, I'm a nursing home consultant, and sent this last week. It says, "'Twas a month before Christmas, and all through the town, people wore masks that covered their frown. The frown had begun way back in the spring when a global pandemic changed everything. They called it Corona, but unlike the beer, It didn't bring good times. It didn't bring cheer. Airplanes were grounded. Travel was banned. Borders were closed across air, sea, and land. As the world entered lockdown to flatten the curve, the economy halted, and folks lost their nerve. From March to July, we rode the first wave. People stayed home. They tried to behave. When summer emerged, the lockdown was lifted, but away from caution, many folks drifted. Now it's November, and cases are spiking. Wave 2 has arrived, much to our disliking. It's true that this year has had sadness aplenty. We'll never forget the year 2020. And just around the corner, the holiday season, but why be merry? Is there even one reason? To decorate the house and put up the tree. Who will see it? No one but me. But outside my window, the snow gently falls. And I think to myself, let's deck the halls. So I gather the ribbon, the garland and bows. As I play those old carols, my happiness grows. Christmas is not canceled, and neither is hope. If we lean on each other, I know we can cope. Thank you, Steve.
Thanks, and that's Plymouth State Representative Matthew Muratore. And Matt, of course, we've talked in private as well as publicly. And for those of us in the public sector, you know, there are the ups and the downs, and sometimes we're able to do it privately, and sometimes we're right out there in public. So again, thank you for all that you do, and we look forward to seeing you again, joining us next week. And at this time, we're going to go to the chair of the Plymouth Select Board, Ken Tavares. Ken, that's a lot to follow.
Sorry about that, Ken.
So, and Ken is the chair of the Select Board for the town of Plymouth. There he is, Ken. Go ahead.
Thank you. Well, Matt, you know that you're my favorite Republican. And ironically, my wife Maggie had picked that form. I think she saw it on social media. So I am so glad that you got to do that today, because you got through it faster than I would have, that's for sure. This program today has been, I think, very special. There's been a lot of personal thought and talk. And I actually want to go down through the list because I think it's important. I have 7 takeaways from this program today, and it's one that I think people should take a look at and see how we are responding as a community. Karen, there are no words that I can express as to how great you've been, and your staff and your Board of Health. You folks are doing a great job. I know you have a meeting at 4 o'clock today that we'll be tuning into, and there's still so much work to do. But I, as one selectman, feel so comfortable with you and your staff doing this work on a daily basis. Brian, you represent the best of the Plymouth schools. The schools, without question, tackle some tough problems, and you seem to be having great success. And as a grandparent with 2 children in the school system, I am so appreciative of what happens on a daily basis to educate our children. Sue, I'm going to call you Susie because I've known you for so many years. You'll always be Susie and me. You are doing amazing work with the homeless and the coalition, and providing for those that don't have it. And the example of people that, you know, look like they're doing fairly well, but they're not, is so important for most of us to keep front and center. There are so many things going on, especially in our community, where we're letting some things just take over. And as I said at the Selectmen's meeting last night, to me, the most important battle we have is COVID, and that's where we need to put our energy. There are plenty of things that we can improve, we can do better, but that will happen at another time once we combat this virus. Mike, the Congressman and you have been phenomenal in your representation for this district. I know that Bill Keating fights hard for the people of Massachusetts and the people in his district, and I am so appreciative. Michelle, your sense of humor today and always puts a laugh on my face. And I must share one with you. As I was listening to someone, one of the speakers today, my phone started to rise up off the table. I looked and I said, you know, it's been one hell of a week. Well, what is this all about? I realized that the charger was tied around my foot. So the more I'm trying to figure out what's going on, the higher the phone score. So I appreciate what you do for our elders, and thank you. Amy, congratulations. The award was absolutely deserved, and the lady that it was named after had a big heart, and you do too. So thank you from the Board of Selectmen to you in regards to getting that award. And as I said, Matt, you are my favorite Republican. Someday you'll stand next to me and say, Ken, I should have had the D, but you know, we'll let that go for now. I'm very thoughtful for your comments today. As I said, I think it was 2 weeks ago, now we're putting names together with the figures that we've been getting, and that makes it extremely personal. And I know that you and Kristen, you know, do everything right, and you know, my family wishes yours. You know, a fast and speedy recovery. I know you can do it. And you, Mr. Moderator, thank you. You keep everything in line. It seems to be going well, and with the help of PAC TV, we're able to navigate these tough waters that we're in, but I feel very comfortable with it. So thank you all very much. Thank you, Steve.
Thank you, Kenneth Tavares. He is chair of the Plymouth Select Board. Please join us again next week when we'll be joined by Ken and Matt, and also Dr. Philip Triffletti, Dr. Barry Potvin, Superintendent of Plymouth Public Schools, Christopher Campbell, Heather Cosby, Stephen Cole, and a member of our clergy. We look forward to seeing you at that time. As you can see, we always have lots of good information from trusted sources and news that you can get right here at our weekly presentation. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.